My name is Gangwani, and I'm a rising junior at Thomas Jefferson High School for Science and Technology in Virginia. Today I'll be presenting my research on child nutrition and food environments, focusing on Ireland as a case study. Childhood nutrition is an essential factor influencing health outcomes and the environment children grow up in, particularly the availability of and exposure to different types of food, which play a critical role in shaping lifelong habits and health trajectories. Throughout this presentation, I aim to explore how Ireland's unique socioeconomic, cultural, and policy contexts contribute to child nutrition outcomes, especially focusing on disparities that exist within different communities. Before we begin, I'd like to share a little bit about me. I'm currently a rising junior at Thomas Jefferson High School for Science and Tech. This is a specialized STEM magnet school in Virginia. Over the past year, I've had the opportunity to conduct research on child nutrition and food environments in Ireland under the mentorship of the University of Galway. This work, which included a comprehensive literature review, has been especially meaningful because it combines my interests in medicine, public health, and social equity. At my school, I hold several leadership roles that have strengthened my skills in communication, organization, and advocacy. I serve as a publicist for both cardiology and environmental science clubs, where I manage the outreach as well as raise awareness about health and environmental issues. I'm also the secretary for the Biology Society and Biotechnology Club, where I document events and coordinate educational programs. Beyond school clubs, I lead social media and communications for the Done with Guns initiative. This is an initiative promoting student safety and gun violence prevention. Most notably, I am the co-president and founder of the Youth for Neuro chapter at TJ. This is a nonprofit dedicated to neuroscience education and mental health advocacy. My passion lies in leveraging science and leadership to address health disparities and promote equitable access to healthcare and education, and this research project reflects those goals deeply. Child nutrition is one of the most significant determinants of health worldwide. Malnutrition in childhood, whether through undernutrition or obesity, has severe consequences that span physical growth, cognitive development, and even emotional well being. For example, children who are undernourished may face stunted growth, weaker immune system, and this increases their vulnerability to illness. Conversely, childhood obesity is associated with increased risk for chronic disease such as diabetes, heart disease, and certain cancers later in life. It's important to realize that nutrition early in life sets patterns that influence health outcomes well into adulthood. Unfortunately, these issues are not distributed evenly across populations. Socioeconomic status, cultural norms, and environmental conditions heavily influence who is at risk. Families living in poverty often face limited access to healthy foods and increased exposure to unhealthy options, which exacerbates disparities. And by studying food environments, meaning the physical and the social settings that affect food choices, we can better understand how to intervene effectively and equitably on the global scale. This is why focusing on food environments is crucial in addressing childhood nutrition worldwide. Obesogenic food environments refer to settings that promote consumption of unhealthy foods, typically high in sugars, salts, and fats, and these limit access to healthier options such as fruits and veggies. These environments can include neighborhoods with many fast food outlets, persuasive advertising for sugary snacks aimed at children, and limited availability of affordable fresh produce. Ireland provides a particularly interesting case study because childhood obesity rates have risen steadily over the past decades, paralleling increased exposure to these obesogenic environments. Additionally, Ireland faces unique challenges based on geography. Rural communities often struggle with limited access to supermarkets and fresh food, while urban areas tend to have a higher concentration of fast food outlets near schools and residential areas. Culturally, Ireland's food traditions and government policies also shape the nutritional landscape, making it a valuable example for understanding how different factors converge to impact child nutrition. And by examining Ireland, we can glean insights applicable to other countries facing similar challenges. For this project, I conducted a comprehensive literature review on peer reviewed studies and public health reports on child nutrition and food environments in Ireland. This allowed me to gather detailed data on dietary patterns, food access, and health outcomes across different communities. I analyzed marketing strategies that target child nutrition and children specifically, as well as looked at policies regulating food advertising and availability. I also explored rural versus urban differences to understand how access and geography affect nutrition. This research was completed under the guidance of Dr. Gyas from the University of Galway, who has helped me navigate the literature and interpret these findings meaningfully. My research revealed several important patterns affecting child nutrition in Ireland. To begin with, many fast food outlets are located near schools, making unhealthy food convenient for students. With that, children are heavily targeted by advertising for sugary snacks and drinks through TV, online platforms, and sometimes even in school. Access to fresh food is unequal. In some rural and urban areas, fruits and veggies are harder to find and are way more expensive. Low income families often live in food deserts and face transportation barriers that make grocery shopping difficult. And cultural norms and nutrition education also affect food choices. For instance, family habits or traditional diets can impact what kids eat, and these combined factors help explain the persistent nutrition related health disparities in Ireland. These findings point to clear opportunities for intervention. First of all, stronger regulation of food marketing aimed at children is needed to reduce the exposure to unhealthy messaging. Second, access to fresh, healthy foods must be improved, especially in low income and rural areas, through subsidized or incentives for stores. Third, we need school and community nutrition education programs that are culturally relevant and accessible. And finally, this issue requires collaboration between governments, schools, health professionals, and community organizations. Working together ensures that resources are aligned and these policies are effective. To conclude, child nutrition and obesity result from a complex web of interacting factors, ranging from physical food environments and socioeconomic status to cultural attitudes and education. These influences shape children's dietary habits and ultimately their health outcomes. Ireland's current situation mirrors challenges faced by many countries worldwide, making it a powerful example to study. Addressing these challenges requires coordinated efforts at multiple levels. Policy reforms to regulate marketing and improve food access, educational initiatives to improve and empower communities, and stronger partnerships between sectors. Only through such comprehensive approaches can we hope to reduce health disparities and promote equity for children's health globally. This research was informed by a range of peer reviewed studies, public health reports, and data on Ireland's food policy, access, and childhood nutrition. I'd like to thank the Global Health Leaders Conference at Johns Hopkins University for this big opportunity, and special thanks to Dr. Gios from the University of Galway for her mentorship and guidance. And of course, thank you all for listening.